everyone, welcome back to our sleep radiology classes. And today we are in the day 2 of radiation protection for pregnant women in radiology. And myself Survey here. So today we are going to discuss about the questionnaires regarding the two topics: undergoing medical examination in pregnancy and radiation exposure to staffs. So please do follow the videos. You will get some more information regarding what measures to take when you are dealing with a pregnant patient or any pregnant staff in the department. So follow the videos and follow the questionnaires carefully. So from our day one topic, it was clear to you what are the various stages of development of embryo and which stages are very much risks regarding um, dealing with the radiation. And also we have discussed about some few questionnaires regarding patient exposures, so always we have to justify it. And above 150 milligram there are chances of intrauterine death, and we were clear about what does 10-day, 14-day and 28-day rules stands for in radiation protection for pregnancy. And now we are in 28 days rule only, but when we are in CT scan or barium, we are using barium or any ionization radiation procedures where there is contrast media, we have to follow the 10 and 14 days rule only, but in other cases we can follow the 28 day rule. तो आइए चलते हैं, हम देखते हैं कि undergoing medical examination in pregnancy. So we have some questionnaires and we are going to answer them. So first of all thing is, can a lady who is pregnant can undergo medical examinations or not? So what are the criteria you have to follow as a radiographer and radiologist? That are things we have to discuss in this topic. So first question is, what if a patient undergo abdomen scan before realizing that she is pregnant? तो अगर किसी लेडी ने उनको पता ही नहीं है कि वो प्रेग्नेंट है या नहीं है, पर उन्होंने एब्डोमेन सीटी कर लिया है, तो इसमें कोई रिस्क है या नहीं है? तो द आंसर विल बी वेल. इन सम केसेस पेशेंट्स आर नॉट अवेयर दैट दे आर प्रेग्नेंट. इनको पता ही नहीं होता है कि वो लोग ऑलरेडी प्रेग्नेंट है एट द टाइम ऑफ एक्सरे एग्जामिनेशन. जब वो एग्जामिनेशन करते हैं तो बेटर शी व्हेन शी नोज इट शी बिकम्स कंसर्न. तो जब उसको पता चल जाता है वो कंसर्न हो जाता है कि कहीं हमको अबॉर्शन ना करना पड़े. तो इन दैट केस जस्ट मेक श्योर दैट रेडिएशन का जो लेवल्स होते हैं इन केस ऑफ सी टी ए नंबर वो काफ़ी कम होते हैं, तो चांसेस बहुत ही कम होते हैं. नॉट टू वरी. इन दैट केस आप लोग विद द हेल्प ऑफ मेडिकल फिजिस्ट you can do the calculations of the patient from her date of conception or last LMP. So please, those who are taking the responsibilities for this type of patients, do check that their LMP is when, and also please confirm if there is any chances of mixed cases. Next thing is how safe radiological examinations are regarding chest and extremities in pregnancy. Well, it will be nullified. No, less chances. Really, we can see that medically the remote areas or remote studies like chest and extremities can be done anytime during the pregnancy state, but after the 25 weeks there will be chances of CNS abnormalities and it is more sensitive. So please do confirm with the help of NOC, and please protect the abdomen and pelvic areas while you are doing the procedure. Next is, can cardiac catheterization be performed on pregnant ladies? Yes, of course we can do, but justification is very much important, and restriction of X-ray beam to the clinical area where the baby is present, mainly in the abdomen and pelvis area. And primary beam should be kept as far as possible. जितना दूर हो सके primary beam को आप दूर रखोगे. Even selecting exposure criteria and in small time, आप exposure criteria को भी बहुत कम select करोगे और जो आपका time है procedure का उसको भी आप limit कर दोगे. साथ ही साथ अगर उसी area में आपको procedure करना है तो after 37 weeks at least you can do a cesarean section in that angiographic site only. Then you can take out the baby and send to ICU and or primitive cares, and then you can do whatever procedures you want to do on the lady. So that is an option for you. And we have saw many cases which are done on the cath lab where if the lady is pregnant we wait up to 37 weeks, then we or 8 months at least, then we take out the baby, we do whatever procedures we require for at least on the pelvic areas. So that thing you can do with the help of cath lab studies. तो बेसिकली जो अगर कैथ लैब स्टडीज़ है तो आप 8 मंथ्स या 37 वीक्स तक वेट कर लोगे, उसके बाद उस बेबी को डिलीवर करने के बाद ही आप उसी जगह पे आप ओटी अरेंज कर सकते हो फॉर द सिजेरियन सेक्शन. देन यू कैन डू द प्रोसीजर्स रिगार्डिंग योर एंजियोग्राफिक related. Next thing is, can a patient become permanently sterile after undergoing any diagnostic examination? Of course, in X-rays or diagnostic level, we have the level is very low. Chances are also low, as goners are sensitive to radiation. So in that case, you have to apply the gonadal shields, especially to the reproductive age persons and the pediatric patients. So actually the threshold dose for permanent sterility in men is 3500 to 6000 milligram, and in women is 2500 to 6000 milligram. So at least we can say that these levels we won't cross in diagnostic level. तो एक पर्सन स्टेराइल नहीं होंगे अगर आप डायग्नोस्टिक लेवल पे कोई भी प्रोसीजर्स चलाओगे रेडिएशन का. चांसेस बहुत कम होते हैं, पर फिर भी आप लोगों को उन्हीं का गोनाडल एरियाज जो है उनको प्रोटेक्ट करना है विद द हेल्प ऑफ गोनाडल शील्ड, or it is very much important for each and every department. Next is, how can I console the patients and dose risk management regarding the procedures? So well, counseling is very much important for each and every patient as well as to the staffs also. Frequent audits should be taken, and that they are protecting the patient or not. And finally, you if you are having any patients regarding pregnant and those who are pregnant, please do assure that radiation is very much harmful. It may cause death to the new life inside them, even the female staffs, and protect them that they are not in that area. And also proper counseling is required, proper management things will be required. You should not ask them to leave the job, but you can continue their job and you can shift them to other areas. And also care should be taken that overload should not be given on the staffs. It should be for both your employees and the staffs who are coming to your department too. So that thing you have to be cautious, and it will be the main responsibility for the radiographers who are present 24 into 7 hours in the department. And please do assure any female staffs or any female attender that whether they are pregnant or not regarding your authorized entry in the radiation area. So last you can see these are the doses which we can say them that these are the minimum doses which you can see here, and that is the maximum doses regarding the radiation protection. So next last thing we are going to conclude is radiation exposure to the staffs. So if any staffs or any female staffs are pregnant in our department, what are the measures we have to take? First of all is we have to take and give them a preventive care. Next is we have to shift them, and also we have to think that both staffs are same to us, even our employees and the workers who are coming to the department, and we should give them equal care. And finally is that they have the responsibility to inform the RSO, and RSO should give them additional abdomen batch. And in this batch, they are going to record the radiation doses of the fetus along the entire week of pregnancy, and it should not cross more than 1 milligray. It is now the status of ICRP that it should not cross more than 1 milligray, but maximum it should not cross 2 milligray. So the first question we have is, can a pregnant woman continue the work in the X-ray department? Yes, she can continue to work as long as until she receive 1 milligram fetal dose during the entire week of pregnancy. But safety is first, and for both workers and the employees, as first responsibility is to protect the fetus which the woman carries inside herself. So that is why they should be precaution regarding that, and they should inform, and it's also our responsibility to protect them. तो जो भी लेडीज स्टाफ्स प्रेग्नेंट हो गए तो उनका फर्स्ट रिस्पॉन्सिबिलिटी है कि उनका बेबी को प्रोटेक्ट करना है. तो इनिशियली दे विल अप्लाई फॉर एब्डोमिनल TLD बैच और मॉनिटरिंग बैच, और वो लोग काम कर सकते हैं जब तक उनका बैच में रिकॉर्डिंग नहीं आता है कि 1 मिलीग्रे तक उन्होंने रेडिएशन डोज रिसीव किया है ड्यूरिंग द एंटायर वीक ऑफ प्रेगनेंसी. बट if they have received, then and then shift them to other areas, but please take the precaution first. Next thing is, how high is the chances that a staff member will expose to the dose of radiation doses. Occupational staffs working in radiation equipments are generally low, and it should be followed by the ICRP guidelines only and ICRP recommendation only. तो इसमें अगर उन्होंने इंटेंशनली आया है तो हम लोग कुछ नहीं कर सकते, जितना हो सके इनको ही प्रोटेक्ट करना होगा. So this is so you can see here, these are the ICIP guidelines which we follow on the pregnant ladies if they are workers or publics, and there are the chances where the fetal risks can happen or non-fetal risks can happen. Basically, this exposure is not calculated based on the embryo, because we are giving on the abdomen area just to record how much doses is receiving inside the lady. So that was all about our today's topic, and thank you for your patience. And lastly is that stay safe, protect the new life, stay away from the radiation area, and always inform me if you are pregnant or you have the chances to be pregnant to the staff who is going to undergo the procedure. And female radiographers, please do confirm before entering into the radiation area, and also apply for the additional batch. If you have liked our session, please do like, subscribe, and share it to everyone, and make this an awareness campaign for all. Thank you.